Much for inviting me to speak. And I had told them earlier that I do a lot of these presentations because writing for publication in a journal is not the same as writing course papers and dissertations. People think they can cut and paste. They think they can just take that paper and send it as a manuscript. But believe me, the editor and reviewers always know. So I think there's tips and strategies that are really important to build in your own toolkit when you go to write for publication. So I'm hoping to share what I consider the critical ones, both as an author and as an editor. So I know the editor's side as well. So thank you again. So what do we write about? I mean, a lot of times people think they have to have big funded research projects, but actually if you look at the nursing literature, most of our articles come from small studies, pilot studies, studies that were done on a unit and are not large R01 funded studies. That would be nice, but most of us don't have that luxury. So one of the things we write about are small studies and pilot work that you're doing. The nursing education journals are unique in that many of them publish lots of teaching innovation articles. So a new innovation you're trying in your school that isn't studied, but you have some evaluation data and it's innovative, that's a wonderful manuscript to think about preparing. And in the health fields, we now have a lot of journals on quality improvement. So studies that fit within a quality improvement or Squire manuscript framework is another area that you can write about. If you have clinical practice, I think these last two bullets are for you because most of the journals in nursing are clinical journals. They need manuscripts, new updates, projects on the unit, or if you're teaching a clinical course and you're updating content, you're adding new pharmacology, right there is the basis of a manuscript for a clinical journal. So we can write about lots of different types of papers in nursing education as faculty and as clinicians and leaders. Now, what I've seen over the years, and this is what I consider number one tip this morning, people write drafts of manuscripts. Then they try to find a journal that fits, and that is really opposite. So if you look at the technical writing literature, you are trying to write a manuscript that will be accepted for a particular type of journal. So instead of drafting a manuscript first, my recommendation is think about the purpose or aim of the manuscript. Think about who you want to read it. Do you want a leader in nursing education or a dean? Is it more administratively focused, or a faculty or a sim director? So think about the purpose and readers. Find the best journal that fits that topic. Then you can start to write the draft to fit the manuscript. So I think this is really important because most novice authors do it opposite, and they have a great manuscript, but unfortunately it doesn't fit the writing style or the substance that all of our current journals are looking for. So I'm going to give, I think, just a couple of examples here. So this is one, the aim of the study was to look at relationships between conceptualizations of social support and self-management. You just have a sense by reading this aim, you know it's a study, so it has to be a journal that publishes research. It's very formally, scientifically written, and this came out of nursing research. If you sent this purpose statement to a clinical journal, there's a gastroenterology journal in nursing, it's written a little bit too formally for them. They publish research, but they want something more reader friendly. So here's a good example of a purpose of a study written more scientifically that fits a formal science type research journal in nursing, such as RINA, Nursing Research, Western Journal. And here's another one. Same type of article, it's a study too, but here we're looking at the impact of evidence-based practice alarm management. We're talking about cost. We're talking about impact on RN time. And look at the writing. It's much more reader friendly. So this article was published in Journal of Nursing Care Quality, but the authors could have also sent that to Nursing Economics, to the Joint Commission Journal, or to a journal if the alarms were in critical care. They could send it to Critical Care Nurse or any of the other critical care journals. but the writing style is much less formal than that earlier example. So before I look at how to find a journal, these are two really important examples. Think about your purpose, who you want to read it. Search for some journals that publish this type of article with this aim for these readers. Then you write your manuscript to fit that journal. The problem now is there's so many nursing journals that there's about 650 tagged as nursing in CINAHL alone, but a lot of us write topics could go into medical journals and a broader list. You have to be very careful now when you search for journals to submit to, because now within the last 10 years, we've had a growing number of what we call predatory journals. They look like legitimate journals, but unfortunately they're not. And I have a couple slides at the end, I think. So you have to be really careful when you're selecting a journal these days. This slide, I want you to save and bookmark. These are the three, I think, best ways to find a potential journal for your article. The Directory of Nursing Journals, Jane, and PubMed. So let's look at each of these. This is the Directory of Nursing Journals. It's run by the Nurse Editors group. This is a screenshot. You can search for potential journals by using the sort or the filter. And there's about 280 journals on this website now. What I like about it is each of the journals has a link to the actual journal website. So if you look at, AACN Advanced Critical Care, there's actually a link to go right to that journal website to read more about the mission, length of manuscripts, types of articles. And there's also a link to the editor to send a quick query email. So I always consider this one-stop shopping. Go to this website, search through, get a list of about 5 journals that might fit your purpose and readers, and then you can send a query. You can look a little bit more about the journal and send a query to the editor. I tell people start here first. And the other thing is these journals have been vetted by a group of editors, and if there's a problem with the journal, or we found last year a couple of the journals were purchased by predatory publishers, the journal then is removed from this website. The other site is called Jane. This is excellent. I would bookmark this as well. Jane is the journal author name estimator. And what's nice about this website, you can type in a title of your dissertation, title of an abstract, title of something you sent to a conference. You can type in keywords. I typed in teaching strategies in nursing. You can take an abstract that you sent to a conference that now you're thinking, I really need to get this published, and paste it in. And the website has software. It searches through keywords, and then on the next screen, it gives you a list of all the journals in PubMed that publish articles about that topic. So it's a nice way to, I think, to go from an abstract or a whole list of words that you're not really sure what journal to submit to a list of possible journals. Take note that last year, this website added green boxes that say in Medline. And I'm going to talk about that in a minute. So when you use Jane, select a journal that has a green box that says Medline indexed. If it has a gold box, it means it's open access. That means the author has to pay to publish. So there's two kind of nuances here you want to know about, but this is a wonderful site to use. And I use PubMed for searching for articles. It's easy to use. Go to the PubMed screen, click journals in the PubMed database. Now they have a brand new main screen that's in, I think, beta testing still, but this is the screen up until now. And type in your topic. I write about nursing education, type in the topic. The next screen tells you that 76 journals are in the PubMed database that publish articles about nursing education. And I have arrows here to show you, again, what I showed you in Jane. You want to select a journal in PubMed that is indexed for Medline. And I want to say that again. You want to select a journal in your 76 here that is currently indexed for Medline, because what someone found last year, some of the predatory journals are now sneaking into PubMed. They're not in Medline because the Medline database has really strict criteria for indexing journals, but PubMed is broader. And they found some of the journals now are now predatory journals that, and you might find them in PubMed. So be careful, use one that's indexed for Medline, and you'll be safe. I think it's a good idea to send a query email. This isn't required. Many of the editors don't answer emails, but I think if they do, it'll help you sift through journals. So if you send one and the editor says, I'm really interested in that, put that on top of your potential list. Or they might say, we have too many manuscripts. We don't want another one on Flipped Classroom or on Sim that's this tight. So it helps you sift through possible journals for your submission. And a query email can be really short. Don't bother to send an abstract. Don't make it really long. Make it easy for the editor. What's the paper about and why does it fit that journal? And you can send as many queries as you want, but the minute you submit the manuscript to a journal, you can't submit it to another journal until it's rejected or you actually withdraw it. So by US copyright law, you can only submit a manuscript to one journal at a time because it implies transfer of copyright. So here's an example of a query email. I said it was short, 3 sentences. I'm interested in submitting a manuscript. You can fill in the journal name, or you can make it even generic and copy and paste to your journal. This is the topic. Are you interested? So I think it's worth your time to do that. It'll help you identify about 5 journals that are possible. So think about your purpose, your readers, go to the directory of nursing journals, then to Jane, then to PubMed, and you can do the same thing in CINAHL. Get a list of about 5 journals, send a quick short query. It'll help you shift that list of 5. Then you're done with this process. And the other advantage of doing it this way, most of us have day jobs. We don't do this full time. If your journal article is rejected, you never have to go through these prior steps again. You cross that off your list, you go right to the second journal because all 5 were relevant in your initial kind of searching for journals. The information that you need to prepare your manuscript is at the journal website. The format you use for your thesis, for your dissertation, is not the same as a manuscript. The way you organized your method, it's not the same as a manuscript. So when you get to the part of actually preparing the manuscript, the length of the manuscript, the type of reference format, the type of writing, everything you need to know will be at the information for authors at the journal website. This is what you want to follow for your manuscript. A manuscript will have 5 different parts if you have tables and figures, otherwise it'll just have 3. There's a title page, that's a separate document, an abstract that's usually separate, that's pasted in a box, the text, first word through the references, each table and each figure will be uploaded as a separate file. So when I prepare these, I actually prepare these in individual files because when you go to upload it, you'll upload your title page separate, abstract you'll paste in a box separate, the manuscript separate, each table, each figure is uploaded separately. So make it easy on yourself. Don't put it in one file, make it separate files, save it somewhere so when you go to submit, you save yourself some time and effort. Nursing and biomedical journals use 2 types of abstracts. This is an example of a structured abstract. These range from about 75 to about 250 words. The author guidelines tell you the headings to use and the maximum number of words. Unstructured, the author guidelines will say submit your abstract in a paragraph form or a narrative form. These tend to be shorter, 35 words to about 75. I think these are harder to write. This is a really good unstructured abstract, and I think the Jonas website will have my PowerPoint to take a minute to read it. This is, I think, this was a journal that allowed, I think, 35 words. But you know it's a study, you know it was a random assignment, and you know what the outcomes were. So these are, you have to get the whole gist of the abstract in a shorter number of words with an unstructured. Your abstract is really important to write, because when I come along searching for articles, I'm not going to read every article. I'm going to search title, which should be really descriptive of what's in your paper, and I'm going to read your abstract in PubMed or CINAHL. I'm going to make my decision whether your article, your study fits what I'm looking for based on those two things alone. So take some time to, when you write these, I like to write my title and abstract last, get the paper written, and then think what title and what abstract really fits what you have written. I think it makes for a better match sometimes. I'm going to go through these center slides in my presentation today a little bit more quickly, just so you know what's available as a resource to take with you. If it's a research manuscript, if you're presenting a database paper, whether it's for a more scientific journal such as Research in Nursing and Health, Western Journal, Journal of Advanced Nursing, Nursing Research, a formal research journal, or it's a research study for a clinical journal or an educational journal or a QI journal. If it presents a study, we use for the manuscript the IMRAD format. So this is standard. You'll have an introduction. Sometimes the lit review is separate. Other times it's in the introduction. It's not a long section. I can always tell if it's a dissertation because the lit review and the introduction is so long. You need to synthesize it for a manuscript. Then the methods, then the results, and then the discussion. If it's a review article, a systematic review, an integrative review, a literature review, and now all the other types of reviews that we now have articles about, you have to use an accepted reporting method. So I'm going to say that again. Literature reviews, integrative reviews, systematic, and actually scoping reviews are real popular right now. These are really easy to get published as of today in 2020, 2019 too, because people don't want to read 30 articles on concept maps. They want to read one good integrative review where somebody else took the 30 articles and put it together for them. They're good for an editor. I like to publish one or two of these papers every issue of Nurse Educator and Journal of Nursing Care Quality because they're cited more, so it helps my impact factor. So they're good all around. You can't get these manuscripts published, though, if you haven't done the review using a systematic process. It has to be an accepted method. So I want to say that again, a good lit review, it's not going to be published probably if you haven't used Prisma. A good scoping review won't be published if you haven't used some method for a scoping review. So before you start your review next time, day one, say to yourself, am I going to put a lot of time in this and I might get this published later? You're beginning part of a study, beginning part of a project. Tell yourself, yes, you might, and do that initial review using one of these methods. Save it somewhere, because then later, if you think this is definitely publishable, you need that method to report how you did it. So I consider this a really, really important slide because even for an educational project, I'm seeing now reviewers are saying to the author, report your literature using Prisma or tell me what other guidelines you use when you synthesized and evaluated those articles. I like the Prisma website. This is the URL on the bottom. Fits for any kind of literature review. It fits for an integrative review, systematic review as well. The Joanna Briggs Institute has a whole set of review guidelines for doing the review and reporting it if you're doing a scoping, an umbrella review, or one of their other types of review. But Prisma fits almost every type of review. And for articles now, we know from a study we actually did among the editors, many more of the nursing journals are asking for the Prisma figure that maps out the mesh terms you used and your database search. So you don't want to start without this, because in 2 years, what you did is not going to be relevant. So do it as you go along, save the information for a manuscript later. If it's a QI project, it is the IMRAD format, so it's the research format, but in the introduction, you talk about the local problem and the intended improvement, and the guidelines are the Squire guidelines. So instead of Prisma, they're Squire. Last year, we published an article on nursing economics where we looked at how do you actually write a manuscript that's each of these different types. So if you're interested in some comparison, that article might be valuable. This is just a screenshot of the Squire guidelines. The URL's in the bottom. It's a really easy website to use now to organize your manuscript. And you can also use it to plan your study. Now, every other thing seems to be on the Equator Network. So let me just share this. This is a portal of reporting guidelines for all other kinds of studies. So it's not how to do the study, but is guidelines when you get to the point of preparing the manuscript. So it's a really good resource. It's free of charge. You can click all these links. So let's say you did a case report. If you click case reports, you'll get additional web pages of how do you set the manuscript up for a case report. Or if you're doing qualitative research, click that, and there's web pages then that say if it's a qualitative manuscript and it's used phenomenology, this is how you write your manuscript. It's a nonprofit group that runs it. It's a really good resource for authors. Now we're going to move to how do you actually do the steps of it. I think you have to write an outline. You don't want to start out trying to get your dissertation into a manuscript or start fresh without an outline. Most nursing journals have a mean length of manuscripts of 15 to 18 pages. Sometimes that actually includes the abstract. It goes through the references. It's 12 font, double spaced, 1-inch margins. That's not a lot of pages when you're thinking of going from a research grant, a thesis, or a dissertation to a manuscript. So I think it's critical to map out the content in an outline. I like to plot kind of the number of pages I'll write for each section. You can put in due dates. If you want to get the first half done in the next month, put in some due dates that fit in your calendar to help you pace your writing. But if you don't do an outline and put about how many page lengths, a lot of times you'll get to 18 pages and not even be at the method or be at the end of the method section. It really helps you to pare down how much can you write considering these page limits. The writing literature tells us to write the first draft fast, get the content down, look over the organization, don't try to edit. I have a problem sometimes. I'd like to go back over, reread those prior 2 paragraphs. The entire hour you devoted to writing then is wasted on checking commas and checking words. So actually the technical writing literature, I think, has good advice for us in nursing, medicine as well. Get the draft down first. Make sure it makes sense. Look at the organization. Are there gaps that you missed in your outline? Is there repetition? Fix that content and then do one final check for editing. And I'm on the camp, don't keep tweaking. The least likely reason for a paper to be rejected is going to be grammar, missing commas, bad paragraphing. The editor and reviewers are going to say, this is a good manuscript, get an editor. So I don't think manuscripts are worth going through, 20 different iterations. Get the content down, make sure it sounds good, and then submit it. So I want to just make one other comment. I work with faculty every place I've been who like to tweak every single course syllabus. Those are faculty who tweak every manuscript, and they wait on manuscripts to submit it. And again, this is my own experience as an editor. When we like a manuscript, if it's not real well written, I will actually say, this might be worth it for you to pay for a professional editor. Or the reviewers will say, needs to be edited for grammar, but it's probably not going to affect the decision on acceptance. So who can be listed as an author? This is a really important slide because one of the issues we find faculty, I think students, I think nurses, other authors find themselves in is people who ask to be part of a manuscript and they haven't written any of it. They don't really deserve to have authorship. So the norms, the standards are on this slide. There's a couple of different groups that have developed these. The ones that I think all the nursing journals and perhaps most of the medical, if not all, is from the International Committee of Medical Journal Editors. I have the URL in the bottom. It's a really good website. They have a lot of resources for writing, free of charge. You don't even have to register. So you might want to look at that. To be listed as an author, everybody has to have conceptualized, participated in the design of the study, or analyzed the data. So some involvement with that early work on the project, and have to drafted a portion of it or revised a portion of it. They can't just have helped initially. They have to do something with the manuscript, and they approve the final version, and they are accountable to all aspects of the work. So if the figure's wrong, every author is held partially accountable. So these are really important. I think they avoid tricky situations where maybe the dean funded a study and then says to the faculty member in passing, well, I hope my name's on that manuscript. No, the name is not going to be on the manuscript unless you've met these standards. So I just think it's important at the beginning part of writing to avoid conflicts at the end. If other people have helped you, the dean gave funding, then put their names as an acknowledgement on the title page. Any grant funding should be included on the title page. If you've had, excuse me, let me start that again. Any project that you've done in a work setting, you need to have permission to publish that. So that was my first point here. Anything done in a work setting. So if you've collected data in a clinical setting as an employee, as a student, and now you're getting to the manuscript phase, that clinical setting has to give approval for you to publish it, unless it was explicit in the IRB. The same for a School of Nursing. That tool that was developed for your students for the course in the school doesn't belong to you. It's really the school's. So you want to make sure that before you submit the manuscript, you do have approval to publish it. Submit your manuscripts blindly. It's a large School of Nursing in Southeast United States or in New York. It's a small clinic in the Southwest United States. Then when it's published, you can get written permission to go back and add the name, but send everything in blindly. Once you submit the manuscript and it's then accepted for publication, the copyright transfers to the publisher. You can't reuse the text. You can't reuse a table or a figure or anything else in it. So keep in mind, once that paper is published, you can't reuse any of that in your next manuscript about the same project. Every manuscript has to present new information. And I would expect you to cite these earlier publications, but you can't reuse it. You have to cite it as a prior article by these authors. And you can't reuse the table or figure because it's already been published. You don't own the copyright once the article is accepted and then published. Once it gets past the editor, most nursing journals use 2 or 3 peer reviewers. Most of us use a blind review. They look at the quality of the paper. If it fits the journal, we've taken care of that already. And you don't know who the reviewers are, and the reviewers don't get the title page. So it's double blinded. It's an unbiased review of the appropriateness of your paper for the journal and its quality. And a couple studies that have been done on what really will boost a manuscript toward acceptance. So criteria for acceptance. And I want you to look at the first 2. It fits the journal, fits the readers, and it has to be new. Has to be something new. Because we don't want to publish information that I can get in 5 other articles. So you need something new or a new twist. And look at the last bullet. It's not going to be the quality of the writing. So fit the journal, fit the readers, make sure the manuscript you're submitting has something new in it. And then papers can be accepted without revision, very unusual. With revisions, most decisions are revise and resubmit. Don't wait to do them. You don't want to get all new reviewers reviewing it. So try to do that within the time limit that the journal gives you. And it might be reject with comments. And then you're just going to cross that one off and you're going to the next journal on your list. But I want to just highlight again, accept with revision would be wonderful. Revise and submit is really, really common. And so a lot of faculty, novice authors, they're hysterical because they think this dissertation was just wonderful and all these people read it. Well, it's a different group of readers. Now it's in the format for a manuscript. So if it's revise and resubmit, the journal is interested, but they want you to fix it first before they make their final decision. Your summary of revisions that you make should be really detailed. And I believe I did send the Jonas scholars a couple more detailed examples. But when you submit this revised manuscript for either accept with revision or revise and resubmit, you'll have to include the revisions made. My recommendation, make it really, really specific. Page 1, line 5 is exactly where I made this change. So as a peer reviewer, I don't have to read the whole manuscript again. I can go right to my critique and exactly where you changed it. I think this is going to boost your acceptance. Now, let me just end with just a little bit about predatory publishing, and then we will have time for questions. I've left 15 minutes for questions. Most of the nursing journals, I think all but 3 actually, might be more, but I think it's 3, it could be 4, are what we call a traditional subscription model. And so most nursing journals, you pay to subscribe. Either I pay as a nurse educator, or your library pays, but somebody's paying a fee for you to have access to the articles in the journal, and that's a subscription model. But about 10 years or 15 years ago, publishers went to a different model, open access, where the library doesn't pay, the readers don't pay, but the author pays to publish. With open access, I pay to publish my article. I pay the journal to publish my article, but then I get to keep the copyright. And so it's the copyright doesn't transfer to the journal and the publisher. You get to keep it. You can share your articles. You can put them on a website. You can put them in the course. You can take them to a conference and give 500 out if you want it, because you have paid for open access. The open access model, that's a good model, is done by reputable journals that are peer reviewed, they're indexed, and they have ethical publishing practices. So Nurse Educator, Journal of Nursing Care Quality, it's a subscription journal, but we also offer, in addition, an open access policy. So we'll publish your article for free. because it's a subscription. But if you want to pay $2,000, you can actually pay to have it open access. Most of the nursing journals, they're not solely open access. They're what I just described. They're hybrid. They're subscription. You can submit your manuscript, doesn't cost you a cent. But if you wanted to pay for open access, you could in addition. PLOS One, as an example, is only open access. If you submit there and they accept it, it costs you $2,000. There's an Elsevier journal, medicine now, that's $5,000, a little bit over our budget, most of us in nursing. So open access is a great idea, but unfortunately it's led to predatory publishing. And these are not reputable journals. They don't have peer review or it's limited. They are not indexed in PubMed, CINAHL, or Medline. So the minute your article is accepted, they save it at their website, but it's not going to be available when I come later to do a search. And most do not have ethical practices. They use spam emails. You've probably gotten hundreds of these. Submit your article to this journal. Oftentimes they have names that are similar to a reputable journal. And this is a problem also in nursing. Last September, we counted there were 127 predatory nursing journals. And so the red flags for these, they're not in indexes. There's no DOI. So think about an article. It has this little DOI on it. Everybody can find that digital object identifier forever. They don't have those, a lot of them. There's no archiving. So if the journal stops publishing and their website closes, your article's gone forever. So if you use the Directory of Nursing Journals, Jane, and you make sure it's PubMed, make sure it's Medline, you will never have this as a problem. So you really have to be alert these days that you're not inadvertently submitting to a predatory journal. And I believe this is my last slide, so I can open it up to questions then. I do think most nursing articles now are submitted by groups. And this has created some problems for faculty. I think it's likely the same in clinical settings, but I see it mostly in faculty because people want to have their name as first author. So for nursing journals, we do a left to right orientation where the primary main author of the article is far left. Then the person who did the second amount of work on the manuscript is next, all the way down to the far right, where that's the person who did a little to meet the criteria, but not much on the manuscript. The medical journals use a different format. Medical journals put the PI of the grant, the senior author, in the far right. But nursing journals do left to right. Everybody wants to be left on a project. They want to be first author or second author. So this can create conflict. So my last parting tip is when you're planning on disseminating manuscripts, and you can get more than one out of it, plan the manuscripts before anybody writes one word. For each of those manuscripts, list who is going to write the article and the order. And tell what the due dates are and exactly what each person has to do. Map it out ahead of time so you don't have conflicts at the end. And now I'm going to stop sharing right here, and I'm going to open it up to questions.
Thank you so much, Dr. Oermann. That was phenomenal content.
Thank you.
Does anyone have a question right now? If not, we certainly have a few.
I think you guys should start. You're hosting.
So I had a question. You had mentioned that Nurse Educator, among other journals, uses a combination potentially where it's a subscription journal and also potentially this open access component. For your journal and maybe others like it, is the same rigorous process in terms of peer review?
There's no difference at all. Absolutely. That's a really good question. So for hybrid journals, which is 99, I shouldn't say 90, I'm guessing 90% of the nursing journals, the paper goes through the regular peer review. It's accepted. When you send the final version in, the final version, you will have an option to do it for free, or there's a little box, I want to pay for open access. So it is at the very, very end of the process, no effect whatsoever on the process of peer review. And that's how they're all set up.
From the
Even for
perspective,
plus one, which is strictly open access, you don't pay until you get to the very, very end and it's accepted and you have the final version submitted.
for the perspective of the writer, you know, to get to that process, is there a, besides owning the copyright, is there a significant benefit? Maybe that is significant benefit. I don't know. Are there any other benefits to going that open access route besides the fact that you own it?
Well, the benefits have to do with the fact that you have the copyright and you have free reign for disseminating, distributing the article. And so, you know, the advantage would be if I'm searching on PubMed and I come to your, or CINAHL, and I come to your article and I think, oh, I want to really read this one about fall rates and how they use SIM to prevent fall rates of patients. But I don't subscribe to it. And I work in a school of nursing that doesn't subscribe to that particular journal. I would have to pay to get it. If it's open access, I can click open access and I can download it for free.
Okay.
So the articles, so nurse educator, we don't have as many that pay for open access, but a lot of times they've been grant funding. And actually now, being in this field for so long, I would probably build into any grants a fee for open access. So the one we published recently, open access in Nurse Educator, was by an NP group where they did virtual site visits using like telepresence robots. It was really interesting. And they had a HRSA grant and they saved funding. Well, that article's been downloaded because it's free. So you go to PubMed and you think, gee, I'm teaching an NP course, I'm interested in this. You can click it and it's free. For Journal of Nursing Care Quality, we've published a fair amount open access when there's been topics that the author or the group of authors want to disseminate. So for example, last year we published the NDNQI new definitions of falls, and I may not be saying that quite right. Vincent Staggs, actually, they paid for open access because they want people to read it and print it off because they had links to all the definitions. So it's been that sort of thing.
Almost more like a public service type of situation.
Right. And it gets your message out broadly.
Where do you see, I mean, this predatory journal situation, just the change in format with open access, where do you see in the next decade nursing research publication going? What do you feel?
Well, everybody's going open access, but I don't see it as much in nursing because we don't really have a model for people to pay.
Mm-hmm.
I mean, people just don't have the funding.
Yeah.
So I don't know. I mean, in Europe, they have Plan S where you have to publish in an open access journal. And there's been a lot of discussion, what will that do for more US publishers? But within the nursing editors group, I just can't see it because people just don't have even $1,000 to pay for an article to be published open access. So I don't know.
I just want to tag on to that advice that if you go for funding or anything, that you should allocate funds to support for open access submission. Having been on the health center side and community, that was part of the challenge. So when I was out in the health center, I wasn't affiliated with an academic organization yet. I was in the front line working with my community. And that was one of the frustrations, that I would go to and identify an article and all I could do was read the abstract. So in some ways it has a broader impact to our ability to disseminate evidence to inform practice. And it's one of the things that I know the APHA for our nursing group section has been advocating for, because those are the benefits. So if you have any opportunity in grant applications you submit or anything, you know, I think the savings and long-term impact, I don't think we can measure because of the ability to reach so many more people with what you're disseminating in your manuscripts and research.
And I'm guessing they're cited more. I don't know.
Yeah.
I think there has been research. I just don't remember it. But I think that's the exact reason, because people are going to read it. And a lot of people don't want to pay $35 to buy the article.
I have one question, which is the ability to work with the journal to disseminate via social media and other ways. I subscribe to some where I get an alert for the table of contents, but I'm not sure, do nursing journals also use social media platforms to also help promote?
Absolutely. So if you go to the Nurse Educator website, as an example, you can sign up for ETOCs, but we also do a lot for social media. So every new article that's published, we send a blurb with photos sometimes of the authors to Twitter. I don't think photos to Twitter, just the statement. We do Facebook. We have an Instagram, and we have things on our website. But if it's open access, that works even better, because the person who does that for the journal, if it's an open access, like the one I mentioned on virtual site visits, she then can attach the article to the Facebook post. So that's the other advantage for that. But yes, absolutely.
We have a question from Kathleen, but I'm not sure if we already addressed all of it in your commentary already. She asked, what are the advantages of paying for open access for hybrid journals?
It's the exact same one. It would be if you wanted to get this dissemination more broadly. But the problem is, again, cost. It's the cost issue.
We had recently, in our recent coursework, learned that really how laborious this process can be, and I think a lot of us were not aware as the author how long this process can be. From your perspective, is there an average time you would tell an author that, from submission to publication that you typically see, or is there such a wide range?
So the journals have a broad range of review time. So I should say, being on the side with slowness as well, but the mean length of time in the kind of the writing literature for nursing is you should get your reviews in 6 to 8 weeks. I think if it's after 8 weeks, email the editor. Go through the journal editorial manager or Scholar One website, send an email and ask for the status of the review. So 6 to 8 weeks is what is considered the norm. After 8 weeks, I think it's getting too slow. Sometimes, there was a journal last year, I do a writing group for the NLN. It was a year. In a year, the reference list is outdated. So I would take that off my list going forward. But I have a manuscript in a journal that's now in review now. It's been 4 months. And I will probably now withdraw it. But the problem with doing that, then I have to submit to another journal and do the reformatting. So ask around, ask Kathleen, ask your mentors, ask other faculty, journals that they've used, and try to stay away from the long ones. You can email the editor to find out the length of time. So for example, for Nurse Educator and Journal of Nursing Care Quality, we have 21 days at the max. And that's why we have a lot of submissions, because we go through the process as quickly as we can. We do 3 reviews. And some other nursing journals, but most I'd say are probably longer than that. People don't want to wait so many months to get the review back, then have 60 days to do a revision, then wait another couple of months. Your hair will be my color. So that's all.
I have a question from an editor perspective. What are the, for folks that then are your reviewers, what are some of the criteria that's used for selecting your reviewers?
Yes.
And the benefits for folks to be reviewers?
I think it's a wonderful benefit for every author to be a peer reviewer of a journal that you have expertise in, because first of all, you know the kinds of papers being submitted. So a lot of times you really know trends in the field before it reaches your school or your clinical agency. I think it helps you improve your writing style and your writing, because you're reading something and thinking, this is not clear. It triggers how you might be writing when there's missing information. Sometimes we get manuscripts where the purpose is on page 3. I don't want to read 3 pages to know where the rest of the manuscript is. As a reviewer, you only have to read 1 manuscript with that flaw. Then you'll know to put that purpose in page 1 or page 2 at the most. To be a reviewer, you have to have expertise in the content area, but you know, nurse educator, Journal of Nursing Care Quality, computers, informatics, and nursing, these are broad areas, but generally in that area. And I ask for reviewers, they have to have published at least one peer-reviewed article. You have to have gone through the process. So I don't know, did that answer that?
Yeah, no, it was very helpful.
So I would say from a reviewer's perspective, when I get a request for a review, they always come like right at the end of the semester, or so. Anyway, so I often have to say I might be able to do this, I could do this, but not until whatever. I started to negotiate with the editor about that, and the editor can decide, no, we need it sooner. But how hard is it to get reviewers, Marilyn?
So you have, as an editor, I don't, so some journals do have trouble getting reviewers because some of the journals are really narrow topics.
Yeah.
I mean, there's just not a big pool, and they're research-based, so you need statisticians. For nurse educator, I have about 150 people that are peer reviewers. So when I took over, I actually built the reviewer base, and you need it for just that reason. Because manuscripts are always submitted in January after the holiday break and in the summer. I mean, because everybody's using that time. So you need a big pool, but as a reviewer, just decline it. And then, you know, the editor will just get another one, or as you say, I might say, just turn it in the next week. You know, so from the journal side, you really have to have a big pool of reviewers these days. For Journal of Nursing Care Quality, I can actually use more people because a lot of those are clinicians or in quality management positions. They don't have as much free time as faculty.
I think we're just at time. Any last questions for anyone?
I don't have questions, but I have a recommendation. One, make sure that this recording gets posted to the AACN community for all the Jonas scholars, because it's really value added and there's no reason why it should sit in one place. And send us the link and we'll also promote it on our social media for Jonas. A great topic, excellent. I mean, I really loved all the resources.
Thank you so much.
A lot. So, you know, paying it forward is about sharing what you did today. So thanks so much for hosting this.
Okay, and thank you for inviting me.
Thank you, everybody. Thank you for
Bye-bye.
attending.